Gabrielle came to us as a new patient, and in our new patient interview, we always ask, are you in pain, right? Because a lot of people have been living with pain for 10, 20 years, and that pain becomes their baseline, which is actually quite a sad state. To be living with chronic discomfort of the head and neck for many years, almost to the point where you just don't notice it anymore until somebody points it out. We talked a lot about different muscle groups and things like that affect the bite and the chewing cycle, and when we took a look, we noticed that she had about 12 restorations that were placed about 20 years ago that were never quite in line with her bite. She had a lot of complicated surgeries, jaw advancements, that sort of thing, and nothing quite lined up when it came to her teeth and her jaws, which was creating this low-grade discomfort that had really started building over the years. And even after the consult left, we just left it as, okay, we'll continue to observe this and watch for this. It's nothing we needed to treat at that time. She didn't feel compelled. Until about 2 weeks later, she called and she said she was having a flare-up and that she couldn't make it to her appointment. And so we said, hey, come on in. This is what we do. We do TMJ flare-ups, acute TMJ management. And when she came in, her muscles were sore all the way in the back of the neck, the jaw, the temporalis, the digastrics, sternocleidomastoids, and we performed multiple muscle releases to give her that instant relief. And after that appointment, we kind of looked at each other and we're like, hey, I think it's time to really start taking this bite thing seriously, because she had a lot of people she was caring for, and if she's down, other people can't benefit from her care. So we went through her case and replaced all the upper teeth, but we did so in a way that lined her jaws up properly. We used some jaw aligning appliances to get proper records and worked her bite out through the temporaries. Her immediate response was that her muscle tension that she had had for many years was completely gone. We were also able to make a lot of cosmetic tweaks, because now that we had the bite figured out, we had the muscles lined up and the jaws lined up, we could then create whatever artistry we wanted. So we brought out her buccal corridor, made it a little bit wider. We also thinned out the front teeth a little bit more. They were a little too bulky for her liking. And we also modified the color. So now she can actually feel good and look good. If you're struggling with chronic discomfort, maybe you've had a lot of orthodontics or braces or restorations placed, crowns, bridges, fillings, that sort of thing, and things aren't feeling like they're lining up because you're having chronic head and neck pain, give our office a call and we can start working through some of these problems.